I'm an early career researcher in the psychology department of Swansea University. I'm the PI on a CHERISH-DE escalator fund to develop a healthy eating mobile app. The idea for the project came from some of the findings in our labs, and then we wanted to see if we could apply them in the real world using mobile technology. My research interests and expertise lie in behavioural interventions for healthy eating. In order to try and extend these findings, we wanted to use technology to work collaboratively and develop the mobile application in a very interdisciplinary manner. After showing in the lab that a very theory-led mindset task allowed people to resist the temptation of unhealthy snacks, we then looked to develop an app that could deliver this task and some reminders to people in real time over the longer term. The main aims of the app were to deliver the mindset task, that app should then send timely reminders to people when they were about to eat, and has a just-in-time function for when cravings were occurring. The aim of the app is to send personalised goals to people when they most need them to support healthy eating. Working closely with my colleagues in computer science, we developed a prototype app which was then subjected to a series of expert panels, public focus groups and pilot sessions. Each time we modified it to make the improvements suggested, until finally we had a ready system that has now been tested over an 8-week period by over 70 users. I worked with SimulConnect, who are software developers for health, and they were hugely useful in the process, provided expert advice in the development of the app, and I've now gone on to develop another project with them, which is great.
I am the founder and CEO of SimulConnect. And in SimulConnect, we work with the NHS. It's a user-led company. We wanted to have collaboration with Swansea University. That's the first step. And then this particular project was very dear to our hearts because that's where we are working on mobile devices, personalization of mobile devices, as well as integration with the clinicians. This particular project had added innovation in it. It's the first time we are working with a psychologist and also with the university in a more official way. Working with a psychologist, it brings us the ability to use mind tools in a mobile app. So the whole design and the screens you get are much more user-friendly for the particular purpose.
I used some of the funding to recruit an RA. I was a computer science graduate. The role of the RA was to develop the app. The skills that he gained throughout the project were great on his CV, and he went on to full-time work in a related discipline.
Our main contribution to the project was the advisory role and the design of how a mobile app would be used. So Menna and her team actually had access to our IT director and myself.
Computer science worked very differently to psychology. We had to communicate regularly in order not to develop the app in a way that was purely computer science or purely psychology orientated. It has led me to pursue interdisciplinary research in the future as well. Working with a colleague in computer science has really opened my eyes to a user-led way of working, which has been hugely beneficial in terms of co-creation and the way that I've gone forward with my research.
Working with Menna, it gave us a lot of synergy where we can probably go to the next step. So we were discussing future projects, funding collaboration. In the world now, there are lots and lots of apps, but there is nothing like this one that Menna has created. So we would like to be involved in any future work that Menna needs to do with this for a wider impact.
The skills I've gained throughout this project have been invaluable. They've given me a huge amount of confidence in pursuing future collaborations and being ambitious in grant applications.